everyone, it's Dr. Duong here from East West Wellness and Rehab. Welcome back to my channel. For this video, I wanted to do just a casual chat with you all so you can get to know me a little bit more and get to know what East West Wellness and Rehab is all about. I have 3 questions ready for today's video that my patients usually ask me, so let's get into it. The first question is, when did you start your practice? I started East West Wellness and Rehab at the beginning of 2022. Now, I graduated from University of Lynchburg's DPT program in 2020, and then I worked 2 other jobs before starting my practice. This year, in May 2023, I actually opened my very first office, and I share space with a podiatrist in Alexandria. Now I am primarily taking patients in the office. I do take a couple mobile visits just depending on the patient's goals, their circumstances. It's a little different every time, but the availability for that is more limited because I do want to use my office as much as possible. Another question that I get asked a lot is, what are the Eastern practices that you provide? I wanted to provide my patients a very holistic way of healing. So I wanted to combine things that I've learned from Eastern medicine and then things I've learned from Western medicine all together. Cupping therapy is one of my most popular Eastern practices, and it is used a lot in traditional Chinese medicine, but it honestly is used all over the world. It is a non-invasive practice that uses suction to create decompression in areas that are tight, and it also helps stimulate qi and helps move that qi through meridians again and unblock them. If you are interested in learning more about cupping therapy, check out my other videos on it. So that's one of the Eastern practices that I use. The other thing that I would say is very much like Eastern medicine is I'm a very spiritual person. I use a lot of intuition during my clinical reasoning and process and helping patients problem solve. And what that means is I still use all of my clinical expertise, evidence-based practice. It's still very scientific in the way that I treat, but I also make sure to listen to those intuitive whispers that tell me like, hey, let's focus on this thing today. So when I'm working on a patient, I'm really honing in on everything that they're saying to me. I think the subjective history where you're getting to know a patient is super important and valuable. Your patients will let you know exactly what they think is going on and will hint towards it, whether they know if it's connected or not, right? They'll give you a lot of different pieces. This is where I come in, where I'll take those pieces and try to put them together and make it make sense. Oftentimes, I'll ask my patients more holistic questions rather than focusing on the physical symptoms of, hey, what hurts? How long has it been hurting? What's your past medical history? I'll also ask them different things like, have you had any, big life changes recently? Because trauma, stress, those things can impact your emotional and mental health and manifest into physical symptoms. And this is a big topic that is thankfully talked a lot more nowadays, but honestly, not enough. I will make another video on that because I think it's super important for people to know about. But bringing it back to the holistic aspect, intuition's super important. I think it's very valuable, and being able to connect with someone spiritually, mentally, emotionally to help them get to physical healing. I find really good results with it because honestly, sometimes patients just want a healthcare provider that cares for them rather than a healthcare provider that sees them for like 10-15 minutes and then gets tossed to the next person, right? Before they can even finish their sentence. My intuition, cupping therapy, and being able to take more holistic aspects of wellness and talk about it and not be afraid to talk about like the mental, emotional impacts of a physical injury. Those are the ways that I bring that Eastern piece into my practice and call it East West Wellness and Rehab. The last question I have for this video is, what kind of patients do you usually work with? I work with a lot of patients across the lifespan. So I've worked with kids, teenagers, all the way up to geriatric patients. but the most common would be a lot of return to sport athletes or just people who are active adults. They tend to have one thing in common, and that is they want to get better. They want to put in the work, do their home exercise program, invest in their health, and live their day-to-day without pain again. And honestly, I have the best patients in the world because that makes my job easier. When they are able to understand the importance of holistic medicine and really want to tackle the root cause versus just the symptoms and putting a band-aid over the symptoms, that's when we can really work together as a team to get longer lasting results. My patients also understand the importance of wellness, recovery, and prevention. So even after they graduate from physical therapy, from their rehab program, they'll come back for a lot of wellness and recovery services, including cupping therapy, dry needling, and even wellness screens. That's all I have for us today. If you enjoyed this video, hit the like button down below, click subscribe if you want more content from me, and let me know down in the comments what other questions would you want me to answer. See you in the next video. Bye!